Welcome to CivilNet. Today we're joined by the Chief of Staff of the Prime Minister's Office, Arsen Torosyan. Mr. Torosyan was also Health Minister throughout much of the duration of the pandemic and the Second Karabakh War. Mr. Torosyan, thank you very much for your time.
Thank you.
So to start off, how are you settling into your new role, and can you explain a bit what being the Chief of Staff of the Prime Minister's Office entails?
I can say that I didn't have enough time even to imagine how I'm settling here, because the movement or moving from my previous role to a new one was so quick and reactive or proactive. I can't even find the exact word, that I can't even separate my previous role to a new one, because actually I used to be a member of the government, and I was communicating with the Prime Minister office like in a daily manner, and was aware of nearly everything that was going on here. And now I'm managing nearly all staff in the Prime Minister's office, including the office staff itself. There is several hundred people. Plus, I'm trying to coordinate the work of the general government, ministries, agencies under the government or under the Prime Minister. And if I compare this job to my previous one, the previous one seems to be very childish compared to this one. It's very hard to catch up all the information flows coming from different ministries, agencies, then send it back to the correct receivers, again ministries and agencies, plus be aware, be on alert every time Prime Minister needs something or assign something to do with the ministries and agencies. And I can say that my main responsibility or purpose to come here is to try to restart the work all public institutions, or not all executive institutions do in Armenia. And of course, there needs to be some time passed to assess whether we were successful or not. But I can say that we can notice that government structures, agencies and ministries are trying to come back from the crisis, post-war crisis, post-pandemic crisis. And the life in Armenia is coming into the general manner, and we all try to put our nearly every effort to this task.
And obviously I have to ask about the POWs issue. Of course, this is one of the #1 priorities for the Armenian government. As of yet, 69 have returned. The lawyer representing the families, Siranush Sahakyan, has stated that there may be over 200. Can you tell us a bit about the situation, what the government is doing, how it's going within the government?
I personally is not in charge of the work or the activities concerning the return of the POWs, prisoners of war. But I'm aware of the situation that several government agencies, mainly National Security Service, Deputy Prime Minister and Prime Minister by himself, are putting nearly every effort for their return as soon as possible on all levels, starting from the heads of the states and ending with like technical working level people. There can be some estimates of the numbers, but as far as I know, there is certain number that is confirmed by the Azerbaijan and Of course, work is being done to try to confirm more POWs because there are some evidence, video footage, photos from social media that may say that there are more POWs than confirmed by Azerbaijan. And we do all our best for their return as soon as possible. I personally is more involved in issues of social character of their families in Armenia. Like yesterday, Prime Minister was in Gyumri and met with the families of the POWs from Gyumri, and there were some issues regarding social support programs that government provides, and we'll try to fix them.
Mm. And I also want to ask about the pandemic and your role as health minister. Initially, Armenia was cited as this success story, and then that flipped when cases went up. But then again, it went back to being cited as a success story. In Britain, even the Mail on Sunday columnist Peter Hitchens was citing Armenia as a success story and also as evidence why lockdowns don't work. So I'm curious what you think. Looking back in hindsight, you were head of the health ministry during this time, and now Armenia is being cited as a success story for not being so strict. What do you think about this when you hear this?
Yeah, we've been facing criticism throughout the whole pandemic, starting from very beginning that we didn't close down the borders sooner than we did. Then we didn't open economy again sooner than we did. Then when we saw the surge of cases in midsummer, then when we again started to reopen the economy, and Prime Minister, General Government, and Ministry of Health as a part of the government always stated that it's too early to assess the results. Even in late spring, midsummer, or even in autumn, because we all knew that lots of uncertainties are present with this disease, starting with the herd immunity thing, how many residents should be contracted with the disease to have herd immunity, starting with these reinfection cases, how it passes from one person to another person, whether masks work or they don't work. But we tried to have a balanced approach. Even now, we nearly don't have any restrictions, only masks outside and inside. And now we are thinking even removing the requirement for wearing masks outside and keep only for inside. But our approach may be a bit different from our close neighbors like Georgia and Iran and even Russia. But experience showed that this kind of balanced approach, or so-called living with virus approach, worked. And now we have, very few number of cases that allowed us to close down nearly all hospitals that were treating COVID. And I can recall that we had nearly 36 or more hospitals treating only COVID cases. Now we have only one hospital, and we even trying to close it down or at least keep only one department for COVID. And the kind of different approach for Armenian government is that we revised our decisions very quickly. And we changed the government decree declaring the quarantine in Armenia a week ago, and we may change it in 1 or 2 weeks again, comparing the situation now and before, and having some anticipations for the future. And this approach worked, and if we compare to the other countries, we see sometimes we are going to lock down for 2 months, or we are closing down all businesses for 3 months, etc. But we didn't do that way. We go like step by step and try to learn how to live with this virus. And and I am not aware about being a success story for the world, but at least we can say that we overcome this crisis.
And I'm also interested that you are saying that your new role is quite intensive, but as health minister, you were not only dealing with the pandemic, but also the wounded coming from the 2020 Karabakh War. Can you speak a bit on this? How did the health system manage to handle both a peak in the pandemic and dealing with the wounded?
Yeah, it was actually a double crisis for that period of time, for this 44-day war. To be honest, we were prepared. We were always prepared, and we are prepared now. I mean the health system of Armenia. We had plans how to act during the war, when a war or any military activities declared at our borders or even inside the country. And we acted due to that plans. We mobilized about 40 more hospitals to take care of the wounded servicemen and civilians, both servicemen and civilians. We managed to put in place very sound evacuation system, including about 100 ambulance cars collected from all over the country, plus helicopters. And because of that, or thanks to that, we had very little number of mortality of the servicemen who are actually transported to the medical facility, to any medical facility from the battlefield. It is low than 2%. It's very good number for nearly all military operations, like for recent, like several decades. Plus lots of medical personnel from Armenia and even outside, or a lot of Armenian diaspora doctors visited Armenia actually for that period of time. And we had two main focal points. One is Goris and one is Vartanis that received wounded servicemen. And we can say that health system, general health system, which consists of 40,000 employees, actually, how we can say that we can say that don't want to use the word overcome, but we could we could stand these crises together, both COVID and war. And there are still wounded servicemen in Armenian hospitals, but very few of them. And now there is a period for rehabilitation services that is again provided by the health system. And if we come back to the numbers, you may be aware that we have both civilian medical system and military. And if we compare the numbers, the 20% of the job was done by the military health system and 80% by the civil health system.
And obviously your former role was ministerial and more to do with policy, whereas your new role is more to do with public administration. What can you bring from your former role that you learnt during your time as a health minister to your new role, and what reforms are envisaged for the public administration sector?
The ministerial position is more policy making for the certain field of the economy or life, but the chief of staff role is also dealing with policy matters in broader fields. But public administration part is also, or reform of the public administration is also integral part of the work of the chief, of not only chief of the staff, but for the whole staff of the Prime Minister office. But this direction is mainly coordinated by one of the deputy prime ministers, the public administration reform. And unfortunately, the pandemic and war hindered this process, and we are trying now to actually, the deputy prime minister trying to resume the work in this sphere. But yes, the services provided to the population, to the businesses in different areas, starting from like taxation and ending with some civil processes, is very important to evaluate the government's work, the efficiency, effectiveness of the government, and we pay a lot of attention to this.
And some have raised the government's communication strategy as an issue. Many are saying that social media is being used too much to release government statements and policies. Do you think it's time maybe to have a regular press pool with regular press briefings so that the Armenian government can more effectively communicate with the public without using platforms like Facebook, for example?
It can be an issue, yes, and we also consider revising our policies in that matter. Your recommendation will be taken into consideration, but if we see that we can see that after government sessions every Thursday, we have at least briefings of the ministers at the government building. But yes, maybe we should organize briefings like on a regular basis for different ministers and deputy prime ministers and prime minister by himself. And maybe it can be a thing to consider, but we cannot undermine the role of the social media everywhere, not only in Armenia, and we have to use these platforms too.
And finally, quickly, I want to ask the State Supervision Service, whose role is to check government expenditure and to look for any discrepancies, is looking into the Health Ministry's budget and to do with the budget that was used for anti-epidemic measures. When they look into these types of cases, they're supposed to report directly to the Prime Minister if whatever are their findings. Have they already reported to the Prime Minister? Is there anything you can say about this issue?
As far as I'm aware, no, because their monitoring operations are still going on. And actually, it's not about checking the expenditures for the COVID, but more general approach, how the response is organized, including procurements and service delivery to the patients, mobilization of the resources, both human resources and equipment, etc. I'm not sure whether they can assess the narrow medical part, but for the general effectiveness part, I think they can add value to this. For government to be more prepared for the crises like that. It's not an issue of distrust to me personally as a health minister or the Ministry of Health or the whole health system. These kind of monitorings are done in nearly all fields and throughout the year, and this is an ordinary monitoring of the certain period of time, work for the certain period of time.
Well, Mr. Torosyan, thank you very much for your time.
Thank you.
And thank you for joining us on CivilNet.